they knew there's only so much I could do without using suction. This is the patient doesn't suffer from tinnitus, so there's less of a risk using suction here, but definitely the left side I wanted to avoid as much as possible. Now, quite often we get inquiries from patients asking that we remove the wax without using suction because they suffer from tinnitus or hyperacusis. We have to explain that it's not always possible to remove wax without using suction purely using mechanical instrumentations like curettes and hooks and scoops. Of course, we'll always make attempt to if possible, but if the wax is right on the eardrum, for example, well, we can't really scrape stuff off the eardrum, so we're going to have to use a bit of suction, or depending upon the consistency, the ear anatomy, it's just not always possible. So we make the patients aware prior to booking that we'll obviously always make attempts, but it may not be possible, and at that stage I'll explain to the patient that there's not much more we can do with the mechanical removal. We have to resort to suction if they want us to. If we don't just do it, we have to obviously advise the patient and let them make an informed decision. So again, I'm just mopping up here, just around the edge. I think I'm going to use the Jobson horn in a moment just to mop up this bit. This is near the entrance. A fine end is really good though. A fine end significantly reduces the noise level. Some people actually find it therapeutic because it's just like a good noise level. It's not excessive. And when you do have patients suffering from tinnitus and you're having to use suction because you've got it's the best and safest option, or the only option, you can go in and out of the ear on a regular basis. Don't overexpose the noise for a prolonged period of time. So that's another way around it. But the fine end definitely is a good instrument. A fine end is an extension to the normal Zollner suction probe. So a normal Zollner suction probe, approximately the outer diameter is about 2 mil or 2.1, and the internal diameter is about 1.6 or 1.7 mil. With a fine end, the outer diameter is around 1.3 mil, and the internal diameter is about 1 mil. So it's almost half the internal diameter, which means half the suction noise. Is it less powerful? Now, yes and no. Because of the smaller surface area, it actually can create more suction grip but on a smaller localized area of wax or skin. So if you reduce the surface area, you're going to increase the pressure. But if you're removing a big piece of wax, for example, it's just not got enough surface contact to remove that. But at the point where it is suctioning on the wax, that particular localized point where there's contact, there is probably increased power. There we are. So that's the patient's eardrum. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.